Thanks for joining us tonight at 11 o'clock. I'm Brian Colleran.
And I'm Lauren Granada. The biggest healthcare provider in Vermont, UVM Health Network, announced that it's making huge cuts to positions in both Vermont and northern New York.
NBC5's Sophia Falbo has been following this story all day long. She joins us now from the newsroom with what we know so far. Sophia.
UVM health officials told more than 140 employees today that their positions will either be cut or reconfigured. Out of that total, nearly 80 positions have been permanently eliminated, and about 65 will be posted as new roles with different job descriptions. 30 people were laid off at Alice Hyde Medical Center and CVPH in the North Country. A hospital spokesperson told NBC5 that most of the positions are administrative. At a Green Mountain Care Board meeting in May, network CEO Dr. Stephen Leffler said officials are trying to get every penny out of the system.
We are losing significant money every month. It's a huge crisis for us, which we're doing our best to address. We're trying to do every step that we can. Provider productivity is one piece of that. But I would say the bigger and more important work is to make sure we're getting full, complete value out of the system.
Hospital officials were unable to meet for an interview today, but we expect to hear more from them in the coming days. Brian?
Sophia, do we know why this is happening now?
Officials have been saying for months that the network is in an affordability crisis. Leffler said it's critical to the network's survival to maximize its efficiency, and this might be one step closer to that. UVM Health is facing a lot of mounting financial pressure right now. The hospital says the changes announced today are expected to save them a little under $10 million a year. But last month, a third-party liaison team recommended the health network cuts costs by at least $300 million over the next 3 years.
It needs to be an efficient system in order to sort of see the advantages of a network, and it has struggled to do that. You know, looking at the C-suite of the network and making changes there isn't enough. It has to go down even further.
This isn't the first time UVM Health has laid off employees in the last 12 months. 77 employees were laid off last year, just a couple of months before former CEO Sunny Eatman stepped down in the fall. Several positions on the network's senior leadership team were phased out towards the end of 2025. What is different this time, some of the terminated positions are patient-facing, including primary care nurses and patient support specialists. Last year, impacted employees primarily worked in finance, HR, and IT. Unions representing healthcare workers across our state say that they're worried.
And Sophia, what are those unions saying about the network's latest move?
Union representatives are calling these cuts an irresponsible decision for our community. AFT Vermont, which represents unions serving the UVM Health Network, said in a statement to NBC5 that UVM Health cannot balance its budget on the backs of healthcare workers. Co-president Nicole DeVita says she's feeling anxious, especially about the quality of care going forward with this massive elimination.
It's going to raise some concerns, right? I mean, because anything that affects patient care, I mean, we all know healthcare in the state of Vermont is very challenging. And any cuts to that healthcare, which is one of, if not the most expensive in the country, is concerning to us.
DeVita says the organization is currently reaching out to its members impacted by the cuts to offer support. She also says impacts on union employees could go into effect as early as July 24th. We'll bring you updates when we have them. Live in the newsroom, Sophia Falbo, NBC5 News.